Righty. Good afternoon, everyone. Welcome to our March Board of Health meeting. So we'll go ahead and get started with our agenda. I don't believe we have anybody for privilege of the floor, correct, Zoe or Liz? Okay. So before we get going.
Or were you saying something?
Nope.
Okay, so before we get going with our agenda, I wanted to welcome Dr. DeLima to the Board of Health. As everyone knows, she'll be replacing David Evelyn, who departed earlier this year. So welcome. And would you mind taking a minute to just introduce yourself and tell us a little bit about you and what you do outside of the Board of Health?
For all the boards that he first. I am an internal medicine physician. I did my training at St. Barnabas Hospital in the Bronx. When I finished training, I came to work at Cuyahoga Medical Center as a hospitalist. I've been in Ithaca for 14 years. And during my Cuyahoga Medical Center journey, I held multiple leadership positions, and now I'm the chief medical officer for the hospital. When Dr. Evelyn retired, I took over his position, and here with what the system is doing. But I think COVID really brought the health department and the system much closer than before, and I hope to strengthen that bond. So thank you.
Very excited to have you. So welcome. Okay, so let's go ahead and move forward with our February 28th minutes and does someone want to put a motion on the floor to approve? So first from Sue, second from Melissa. Any discussion on these? Okay, all in favor as written. Okay, so those are approved.
Brenda's
Out. So Frank, I'll have you do two things, the financial summary and your administrative report.
Sure.
please.
Not a lot to update on the financial reports. I'm happy to answer any questions. Still working on the closeout of last year. County Finance has, I think, now done most of the posting. So our team will be working to kind of wrap that up here relatively soon. As far as an administration update, just a lot of different happenings going on. I've been involved in several searches for countywide positions. So I've been doing a lot of interviews the last few weeks. Director of Finance being one of them, the new homeless coordinator position being the other. So got to see some exciting candidates and looking forward to those processes being completed. We're continuing with our outreach and education around forming of whole health and her team. Additional work. We're really working on internal communications and trying to ramp up our SharePoint site, which is going to be a location for staff to kind of access all the information about what it is we have going on. There's been a lot of energy on the state budget. You guys have a resolution in front of you related to tobacco issues. Financially, the big thing we were hoping for was some additional funding around lead, because they lowered the lead level where we have to do investigations, and there was no funding associated with that. There's a big push this year. Unfortunately, I don't think it's actually in the budget as of right now. So we're still making calls to our elected officials to try to advocate for that. But they have bigger fish to fry. So I'm not sure where that's ultimately going to. But otherwise, that's really all I have to report at this time. Happy to answer any questions.
Any questions for Frank? Motion.
And could you introduce yourself?
Oh, yes, thank you.
And if all of our folks as you report could introduce yourself.
I think I know pretty much everyone from different Zooms, but
governance.
Yes.
Together. Yeah. So here as Director of Health Promotion And I've been at the pet for almost years. Year two. So very. Their additions, I have listed here on our report that the trauma informed training series has started with our mental health partners. And then also the state, in conjunction with our pitch grant, the perinatal and infant community health collaboratives, they've also started up their training series for our community health workers, supervisor, and those are partners who we're working with too, community partners. So they also started a series. So getting lots of good training opportunities. There is formulating first, which is great because the state surveyed all the programs and most of the CHWs are pretty new to this role. So like CHWs who we have, they have us.
This is for Sam on her report.
Good afternoon. Nice to be here. So in addition to what Frank was saying about the lead funding, the governor legislation, not in the budgetary thing, is proposing some fairly significant penalties for illegal cannabis sales. And this dovetails into that report that I gave you several months ago about what was found in terms of the quality of products being sold illegally, contaminants and potency problems, all the things that the Office of Cannabis Management is trying to eliminate through legal cannabis sales. So she's proposing hefty fines and a jerking of licensure for illegal operations, up to like $200,000, $10,000 per day, et cetera. Whether that gets traction or whether the legislature does it, we'll have to see. Dovetailing to into long COVID, in my piece, I included some data about the clinical evidence about long COVID, which continues to be a bad story and a good reason to be vaccinated. But the therapeutic end of it also is not very true. There are no specific treatments. The challenge is for clinicians to discern whether somebody is going through long COVID or some other clinical disease. But symptomatology, but therapeutically, you end up with not very many proven or efficacious methods to deal with it. A lot of it is about more on the level of physical therapy, pacing, mental health issues, et cetera. So basically, when you translate that clinically, it means that people have to talk about it. And long COVID can keep you out of your work and cause a great deal of difficulty. On the good news side, and between my drafting of the report to you and now, influenza has gone from being widespread to regional. That's the good news. Regional means it's less prevalent, et cetera. It does not mean, though, in healthcare facilities like hospitals that they can end masking. The commissioner has not made that declaration. Masking is still required if you're not vaccinated against influenza. But it is marking a turning point, and perhaps in this bimodal pattern that we see in influenza, that it will continue to decrease. One hopes so. Remember that influenza started much earlier this year than usual, and its widespread duration is much greater than prior years that we experienced. With regard to the other problems of RSV and COVID numbers and Mpox, all of those diseases have been and are continuing on a downward trend. So that's a very good thing. And then a little bit of serendipity. The month of March is the anniversary month for the discovery by Dr. Koch of the tuberculosis bacillus in 1882. Prior to that time, it hadn't been identified. Therefore, one didn't know about how to combat it. This infection wasn't a thing that was known to be effective. And that was his success, identifying the bacillus. Along the way in his career, he defined the Koch postulates, the identification of a disease spread by a pathogen as an infectious disease, which basically means you have to identify what you think is the pathogen. That pathogen must cause the disease when you introduce it into a new host. And by fulfilling all four of the postulates, you can be quite certain that you're dealing with an infectious agent. So he went on to do very meaningful work in other diseases, malaria, for example, cholera. But he never did achieve his goal, which was an effective preventive treatment for tuberculosis or a vaccine. And that's where we are today, basically. Although we have additional treatments for tuberculosis, we don't really have highly effective, I would say, preventive treatments. BCG is of some help, though, as you know. So thank you.
Any questions on that? Yes, Sue and then Melissa.
Actually, what's the latest on COVID vaccinations? Or do we just keep getting one every 6 months forever?
I don't think, I would say, best judgment from what I know is not 6 months. But I do think that we'll likely, as we get around to summer, or early summer, be starting to see recommendation for a vaccination in the fall.
Mm-hmm.
I do think we are still going to be seeing next generation vaccines come along. That will be an improvement. As you know, there are some in the works beyond the bivalent that we currently have. So I think we're going to be looking at some kind of a program, probably coupled with influenza, which is also a significant disease, probably on an annual basis for the foreseeable future.
Thank you.
Is there a system for reporting illegal marijuana sales in Tompkins County, or do we just call like?
This has come up.
Do you want to do? Would you like reports?
Did I call myself?
Okay.
If I remember, Frank, to quote you, I think you said that if we get a report of illegal sales, we'll pass it on to the people at state level who are.
Okay.
The Office of Cannabis Management is certainly interested if illegal sales are going on, or if some other trying to circumvent the law is being done by a retailer. And I think from what Governor Hochul is talking about with penalties and so on, I think they're taking this quite seriously. The whole idea behind the law of regarding cannabis was to create a product that the public could have confidence in, and when they paid their hard-earned dollars to buy a product, that they could be certain they were getting what they paid for, that it was be free of bacterial diseases and contaminants and toxins. And unfortunately, in the illegal market, that's not necessarily true. So much better to buy the regulated product with confidence and safety.
Thank you.
Environmental health is interested in seeing what the response is at the state level to these things, because we know that there are sales going on in Tompkins.
Thoughts or questions?
Just a quick update on masking for our buildings. So I think everyone's aware that in February, the state emergency declaration ended. And so therefore the requirement for healthcare facilities to mask for COVID was no longer in effect, and that the state was following CDC guidance, which recommends masking in healthcare facilities when transmission levels are high. We have dropped this week below high, actually 2 levels down to moderate. We have 2 regulated clinics. One in this building, which we really defined as the lobby and the clinic hallway, and then the whole building downtown at Green Street has been fully masked. It is my intention, if we remain below high after the next week's measures, to remove the masking requirement from the buildings. We are preparing some signs that say masks are now optional. Please be respectful of anyone who chooses to be masked. But we wanted to make sure we had at least 2 weeks of data behind us before we did that. So just an FYI that our buildings likely will be no longer mask requirement starting next Monday.
Also, school break is the week of the 9th. I don't know if you want to wait even longer. So you usually have a spike, right? I don't know.
Yeah, I think at this point, we're trying to move towards recommendations across the board, and we were just trying to get to that place. I don't really expect that if things bounce that we're going to keep going unmasking. I think we're unmasking, and then it's going to be recommended from this point forward for anyone that might need it. Just because unless something significant were to happen and we felt that it
So,
Hi, Dr. Belina, I think we emailed at least during COVID. I emailed with the whole county, I think. So nice to meet you in person. I'm Rachel Buckwalter. I'm the Director of Community Health. I supervise a team of mostly nurses. We manage communicable disease, immunizations, maternal child health, blood poisoning prevention, HIV testing, rabies, a bunch of different programs. In terms of my report, I don't have anything to add, really. Just wanted to highlight it's not often that we report a case of malaria and a case of typhoid, but last month we did. So that's a little too much excitement for us, but both travel related and, obviously no risk of spreading here within the community. And just to dovetail on Dr. K's TB update, we did connect with the Ithaca College PA program, and I'm actually going to go present at a class tonight on TB. I'm a public health response and case management for TB cases in the community. So I'm just glad to have that partnership.
great. Questions? Okay. You're next.
I'm Debbie Talmadge from the Children's Special Care Needs Division, which is our early intervention program, preschool, children and youth with special health care needs.
I actually did want to ask on your report because I saw that you had mentioned that you're still waitlisted for the speech pathology services, but that I think you had hired a couple of folks. So do you expect with that hiring that your wait list will go down, or it's still an issue?
It's how it.
Okay. Oh, okay.
Actually, I recommended provider. We don't hire the state. It's a contract for.
Hey Frank, we're not able to hear on that side of the room. I'm not able to hear.
Start over.
That's just
Okay. So we are seeing some therapists coming, and we still see therapists leaving though. Okay. But we did have one therapist that therapy list, so that's a big help. Percent pay increase that the advocacy work has been recently that is sitting in Governor Hochul's office. It's passed the state assembly and the state senate. And that will help bring some therapists back to the field.
right.
And that's, in terms of what the state pays for services, right?
Yes.
Any other questions? I made you move for 30 seconds. I don't think we have our county attorney with us, so I'll skip that. And so Liz, to you for environmental health.
Cameron, Director of Environmental Health. Only thing I would like to report is that we have Brianna Walsh has started in environmental health on March 20th as administrative assistant 3. We are delighted to have her here. She's in a provisional position, so she'll have to take the test, which I think is going to be offered in June, and see if she'll be reachable then. But wonderful to have somebody here. And I don't know if you saw the press release on the fox, non-rabid fox. So it was nice to have a non-rabid fox.
I did a picture too. I was impressed.
That was appreciated by some others in the community.
Yeah.
Trying
Yeah.
not to spread fear.
Yeah.
That's all I have.
And the CSB report, Frank, is there anything?
Harmony is off on well-earned vacation. I don't know. I don't have a CSB report. I'm sorry.
Okay.
I can't. They meet next week. And there's a lot of focus on, actually what they did talk about at the last meeting was the settlement funds. So there's opioid settlement funds coming through the Community Services Board to about $800,000. And I had some conversation about how to target that. And right now, the kind of tentative plan is wraparound services related to folks unnecessarily ending up in the ER or hospital admit, really a process to wrap around them quickly with additional services upon discharge. So that's been sent to the state for approval. And once we have approval, then they'll really get into the details of putting that plan together.
Okay, so before we move to new business, I just wanted to raise something with the health department staff and with Frank about the Board of Health agenda for you all to think about. So we've had turnover on the board. We have new faces, we have new staff, you have a new agency and a new integration and sort of a new way of thinking about life. And one of the things we had started to just talk about just a little bit before COVID hit was what's the best way to present information to the Board of Health in a way that is consumable by us, but is also useful for the health department staff, and also isn't just creating unnecessary report making for you every single month. So since I think we're getting to a point of some stabilization, at least around COVID, I feel like I should knock on wood for that, but I wanted to put this back out for you all to have some discussion about this. So like one of the things that struck me when I read the report this time is, Sam, you have a lot in there around the CHA and the CHIP and the New York State prevention agenda, right? But it's hard for us to understand, like, how does all of this, how does everything that you do actually relate to that, right? I mean, I recognize that, Deb, like you've been talking a lot about the speech pathologist kinds of things. Like there's these issues or policy issues that continue to sort of bubble up. So I guess what I'm asking or wondering is, I don't know how we came to this format. So if there's some state law that we have to do it, so be it. Okay. But if there's not, I think it would be worthwhile for all of you to think about what is the most effective way to communicate with the board about things that are important, right? So if it's that we want to focus them in on these like 5 or 6 really important issues that have happened in the last month or that we're working on, and others can correct me if I'm wrong, I think I would be fine with that, right? And then obviously I think we all appreciate hearing the communicable disease reporting and things like that. So maybe one concise graph or chart that shows us those kinds of things that we have to know. And then I think you also need to help us and move us toward thinking about things in an integrated way. And I just have some concerns that continuing to present information this way isn't going to get us there. So as you work as a staff to integrate, I don't forget about us. And I think that you should be thinking about what's the best use of your time? What's the best use? What information should you be providing us? And how can we help with that information? I don't know if anybody else has anything to add or disagree or agree, but I at least wanted to put that out there.
Really like to see, I mean, I know it's hard to document and the numbers are skewed sometimes, but I would really like to hear every month about our overdoses and overdose deaths. Because I think that's a part. And I don't even know what department within mental health it falls under, but I think that for my constituents, that's where the most concern is in our community, whenever it comes to health department issues.
And we do have overdose data. Are we not adding that to the report?
Yeah, there should be something about
We
it
can-
in there,
We
but
can pull it out. The deaths we don't generally report monthly because there's so few and they can be identifiable. So we do report those out every 6 months for privacy reasons. But yeah, absolutely. We can make that more prominent.
I think if we could verbally hear it, because I think there's impact instead of just getting it, in one of our, packets that has 75 pages. And while I read every word of it, I think it would be good for all of us to hear.
Sure. Yeah, and just a bit on the packet itself, the reason for its length is that the Board of Health packet became the repository for data for the community. It was a place where it was kind of in replacement of an annual report. Folks were looking for more timely, real-time data. And so we began to include much of what was in the annual report into the Board of Health report, which thusly made it 75 pages long because it's essentially a monthly annual report that you're seeing real-time data. So yeah, we've had multiple conversations pre-COVID, even pre most of the current board members about what the package should look like. And so we're always open to making it useful for you in ways. And thought about the kind of the integration is well heard. And that's why I consider that.
I also think we want to be useful to you. Right. Right. And so sometimes we approve or I feel like sometimes we don't give you what we could give you.
Sure. Yeah, and I think also knowing a bit about what the board hopes to be would be helpful to us too, right? In that, because there are certain things, and I'll give my personal bias. You guys are considering a resolution. I don't ever bring those to you guys. They always come from you because I don't know how much value they have or what they do. I mean, certainly your voice matters, but in the state budget, a resolution from our Board of Health, I don't know what that, what kind of value that brings. But if it brings value for you and you want that to be part of what you're doing is communicating to the state, we can certainly bring ideas because there's probably each of our divisions has a resolution we can put together for you to consider for communication to the state about things that are going on here locally. So, and it doesn't mean we need to go from having one every 6 months to a year to doing one every month. But if that's something you guys are interested in, then that's something we as a staff can also look to say, oh, maybe this is something we should bring to the Board of Health in resolution format. So, I guess as we're reviewing too, we'd certainly love to hear what your interests are in as being a Board of Health, what you're looking to achieve too.
Okay, so maybe we can work back and forth over the next couple of months. If you all can think from your perspective, we'll think from our perspective, and then we can figure out a way to meet in the middle. Does that work? Because I would like to make sure this is a good experience for both sides. And I think we got derailed a little bit by COVID, and so have been waiting for a good time to sort of bring it back up. And I think we're so okay. Okay. So thank you for that little sidetrack. So let's hold on a second. My computer just locked me out. Let's go ahead and move ahead with our enforcement actions. So we have 3 today. One's operating without a permit, and then we have one that's a violation of Board of Health orders related to sanitary code, and then repeat critical violation. Before we get to those though, Liz, I wanted to just ask on your summary report, and I also wanted to bring this to the board's attention. I'm sorry, your summary of open Board of Health enforcement actions. I noticed that Dream Vape is now operating under a new LLC. So I don't know if that was their last time and I just missed it, or that was a change to this time. But could you talk a little bit about what that means? So is that a way of avoiding the previous resolution against them? Does that change anything? Is it something we need to be aware of?
Questions.
Okay, well, I didn't know the right way to ask it. And if they only one question, which is what does that mean?
So this is something we are pursuing with New York State Department of Health to try to understand.
Okay,
Because it does appear that Dream Vape, that store at that location had a license issued to a different name from like June to December of last year, when we were doing the Dream Vape enforcement. So, but then they did have their license revoked, I think is the right word, for Dream Vape, right, because of the violations. So we're not sure exactly what it means. It does appear that, like we've been told by New York State DOH, do not go by the name of the store on the outside. It is complicating our enforcement actions and oversight.
I think at some point we need to make Bill Troy, the county attorney, aware of this, because there was much intent behind the idea of pursuing strong enforcement for this organization. And if someone is just able to change the name of their storefront to another name to avoid paying the penalties and having enforcement, then it gives this board absolutely no teeth and no enforcement mechanism. And if one agency is going to, or one organization, one storefront's going to do it, they're all going to start doing that. And so, I mean, I feel very strongly that if we need to proceed down a legal course, we need to do that.
Yeah, we agree. And, we've had some conversations with the county attorney, and I did just reach out to them about their attendance here at the board as well. We're not the only ones facing this, right? I mean, I am hearing from, and I'm sure Liz is, from our colleagues around the state, that this is just the course of business and what they do, and they've been navigating. It's probably going to get worse before it gets better with the additional enforcement that Dr. K was referring to too, right? That we're going to start to see a lot of this moving of names and papers and all of that kind of stuff. But we agree, and we certainly, Liz's team is spending huge amounts of resources trying to manage and follow all of this. And so we're trying to figure out, how do we keep up, right? Because they're paying lawyers and all kinds of folks to manage the system, and we're just trying to do our enforcement with our folks amongst all the other work that we need to get done. So we'll have some conversations with Bill and Holly and try to figure out what next steps are. But we definitely agree that we need to figure something out, because not only is the enforcement, it's also eating up a huge amount of PH resources too.
Not necessarily effectively. It is complicated because the licenses are issued at the state level. I'm not sure what that says for what.
Ultimately, the state hopes this is going to generate some money for the state. Are they talking about providing extra funding for enforcement of, this whole industry that now has to be monitored?
Yeah, I think that's part of what's in the governor's proposal with this package, and much of it goes to the Office of Cannabis Management. My understanding is that them, along with the who gives the tobacco and firearms, whatever it's called in New York.
Yeah.
Yeah, that they will be responsible for the enforcement of it.
Anticipating we'll have enforcement for you next month or the month after. So
under the new
we
name.
can have a discussion.
Okay, so I wanted to make sure board members saw that and realized from two perspectives, which is just the general sort of enforcement that we're doing things that, and then it looks like folks have found sort of a workaround to that. And also sort of you are just aware from a legislative perspective. Okay. Okay. Okay.
2.5 more years to work on this.
Okay. So that I thought, okay. So anyway, all right. So let's go ahead and let's take up I'm sorry, is there any more conversation on that? Are we? Okay, so let's go ahead and take up our first enforcement action, which is related to the Cuga Cafe for operating without a permit. So if we could have someone get us started. I have a motion to approve as written from Sue with a second from Shauna. Liz, any additional discussion on this?
For operating without a permit, and we proposed a $500 penalty.
Any questions from board members? All in favor is written, and that's unanimous. So let's move to our next one, which is, hold on one second, let me scroll. Our next one is related to a violation of board orders for Old Mexico, and mainly about food hold holding and storage, food service workers, and food temperatures. So if someone is willing to get us started with a motion to approve as written, we have a first from Melissa, second from Sue. Liz, is there any other information on this one to make us aware of?
That proposed penalty is $800.
Questions from board members?
I have one question.
Sure.
I just wanted to make sure that there was full understanding of the violations. Were there any language barriers?
No, two of the inspectors that have gone out there speak Spanish. We have provided signs in Spanish that are still up there and have pointed them out during the inspection. So no, language is not a problem in this case.
Thank you for any other questions, comments for board members? Okay, all in favor is written. That is unanimous. And then our last one is for UT. And this also is a temperature and hazardous food storage issue. So is there a motion to approve as written? We have a first from Sue, a second from Melissa. Liz, any additional background on this for us to be aware of?
The proposed penalty is $200.
Okay. Any questions from board members? Yes, Shauna.
I just want to ask the same question about this restaurant as well, as far as the language barrier.
Any other questions? Right, all in favor is written. And that's unanimous. Okay. That's it for enforcement actions for the month. So we have two things left on the agenda. I'm actually going to flip the order of these to talk about the public health director reappointment last. So Shauna, I'm going to turn this resolution over to you for discussion and then to put a motion on the floor. If you want to do that first.
So I will put it on the floor first and then we can have a conversation on it. I would like to move the resolution in support of the state governor's life-saving tobacco control measures. So I had actually heard,
Sorry. First from Shauna, second from Christine. Sorry.
So I had actually heard about the state governor's proposal on this back in January. And I had reached out to Nikki about 1.5 years ago, maybe 2 years ago, about being in our middle schools and high schools. And she works at a program called Reality Check, which is based out of Portland. And they're working at essentially some PR campaigns to reduce and end vaping in our public schools. And so she had reached out after the governor's State of the Union and talked about the proposed budget with outlawing flavored tobacco products And the second part was adding another $1 to the sales tax for all cigarette packages. I did reach out to Leah Webb's office as well as Anna Kellis. I think Anna Kellis is on the fence about supporting the flavored tobacco. Some of the insight and information she provided was she thought that it provided a stigma towards people of color who many times are the ones that are purchasing menthol cigarettes. And so she was struggling a little bit. I personally think that the damage that's happening to our young people that are using the vapes outweighs that. I also think that, you know, while I do understand the equity side of the argument, I think the detriment to our community outweighs that. So I bring forth the resolution. I put some of it together. Some of it was put together by Nikki, and then Katrina McCloy, our clerk at the legislature, also added some information that had some local and some Tompkins County data in there. Happy to
I just had edits on it that I just wanted to make you aware of. And I also wanted to talk about it because I wasn't sure if it was purposeful. So one was that in some places, the phrase is Black and African-American, and in some places, the phrase is just African-American. And so those mean different things to me. So I wasn't sure if that was purposeful because that's the way the data was reported, or that was just a editorial oversight. But could someone read back through and just make sure if it should be consistent, that those phrases are consistent throughout? Then the other thing, again, is a wording thing for me, is that instead of saying homicide, diabetes, and accidents, do we use the term accident in public health anymore? I thought it was unintentional injuries. So I think we should change the word accident to unintentional injury.
Where's that at?
That's in the 1, 2, 3, 4, 5, the 6th, whereas smoking related illnesses.
Okay.
Then I also thought toward the bottom, we should just be clear. It's the third one up from the bottom, the third whereas up from the bottom, where we're talking about the 2023 executive budget. If we should either say fiscal year 2023 executive budget, that's right? Or 23-24 executive budget. So that we're clear what we're talking about. So that was just my. Something was friendly. Okay. Yeah, that's why it was not enough to. Their comments or thoughts? Yes, Sue.
Frank asked earlier, resolutions we're interested in doing, and even if it's just a way to voice to our elected officials. Again, not every month, but I certainly am not opposed to helping to support anybody's effort associated with the Department of Health. If it is a help, maybe it's not, but some.
I absolutely think it's a help. I think what would be even more impactful are telephone calls to your elected officials, right? I mean, we will send this to all the appropriate folks, but you know, a personal phone call to Anna Kellis, who some of you have personal relationships with, to say, hey, this is why I think it's important, will carry more, I would imagine, the same authority than a resolution that we're going to forward from the office. I have called both of their offices supporting this legislation as well through advocacy with their state organization. So we as a department are certainly supportive.
Can we call as a member of the Board of Health, or should we? Okay.
Questions or comments on this? Okay, so all in favor of approving the resolution with the friendly editorial amendments? All in favor? And that's unanimous. Okay.
Just a quick technical response to what you just said. You can certainly call us a Board of Health member. You should be, if you all as a board have taken a position on something, then certainly you can represent that for the board. If it's a personal thing that the board hasn't considered, you can certainly say, I'm Sue Merkel, member of the Board of Health, I'm not here speaking for the Board of Health, but here's, my take on the issue. So perhaps having these been voted on by the board also helps you feel more comfortable perhaps in calling your elected.
And then I think encouraging, like here's an issue that the Department of Health, county legislature thinks is important. So you're educating me and then I can know to go do things.
Okay, so the last item for our agenda is. So as everyone can remember from last month when we were doing appointments, we have a couple of options of how we do this. So one is that if we feel like we need to have any lengthy discussion, we should probably go into executive session. If we feel like it's just a straight up or down vote, I can just put a motion on the table for the vote, correct?
Correct.
I'm asking because last time he was whispering in my ear, so I want to make sure I do it right. So am I able to just ask preferences before I make a decision about which way to do it, or should I just make an executive decision about which way to do it?
Can certainly ask. I mean, really, you're looking for one of two motions, the motion to go into executive session or a motion to consider the recommendation.
So do we have preferences, or can folks let me know what you would prefer? Can someone make a motion one way or the other?
Motion, we consider the nomination.
We recommend him for reappointment for an additional 6 years. 6 years. Okay, so we have a motion to approve the recommendation. Is there a second? We have a second from Melissa. Is there any additional general discussion that needs to occur? Okay, so all in favor of the recommendation to reappoint? And it's unanimous.
Thank you.
No, thank you.
Thank you.
For staying for 6 years.
Your time point is next. If we have no other items, we have covered everything on the agenda, so we will go ahead and adjourn. And we'll see everybody next month. Thank you. Yes.
So can you cancel us?
Keep finishing. She's
Yes, I just